everyone. This is my change quality management project. My name is Mkang, and this is for Nursing 451, Nursing Leadership and Management Laboratory class. The quality standard that I will be addressing is improving rounds with communication interventions. According to Joint Commission, handoff communication is the process of communicating patient information from one caregiver to another, or from one team of caregivers to another for the purpose of ensuring the continuity of safety of a patient's care. Communication is an important factor in any healthcare setting, which prevent unnecessary medical errors or adverse events. According to Eggins and Slade, finding communication skills during rounds between the healthcare team members can reduce medical errors. To improve patient care, healthcare team members must find ways to initiate an effective handoff communication and interventions. Some of the many benefits of improving communication at handoff are reduced safety risks at each shift change, emphasize patient pertinent specific information from one caregiver to another, and prevent adverse events from missing gaps in communication. The effectiveness of communication tools, I pass the baton, SBAR and Team SPEPS, is that SBAR is being used in other countries such as, in other industries such as aviation and nuclear power industries, and it helps to communicate critical information. Teach-back family involvement and bedside handoff has shown to be effective with the patient and family. In the United States, at least 50% of adults are considered to have low literacy. Therefore, it ensures patient and family understanding of care being provided. Handover communications has shown that effective handover communication assists in the ability of the next provider to provide optimal care. Hospitals continue to struggle with handoff communication, and communication was one of the top root causes of sentinel events, as reported from the Joint Commission from 2011 to 2013, and ineffective handoff communication has been a primary contributing factor in many studies of causes leading to medical errors. There is an information transfer issue between the sender and receiver of information in this case. The scope of the problem was determined by interviewing a nursing leader, nursing staff, medical doctors, and several patients on the unit of my clinical choice. According to the interview with the nursing leader, some of the problems encountered at handoff is poor communication and organization skill with individuals. The nursing staff at interview felt that improved communication tool to stay organized during their busy shift may impact how effective their communication may be, or handoff may be. Many of the medical doctors agreed that existing team steps meeting at beginning of each shift was helpful in juggling many patients during each shift. However, they did mention that handoff communication of patient information and condition during shift was not as efficient as it should be from nursing staff. Poor communication between staff caused confusion, especially during busy days. Many patients have indicated that they do not remember their nurses or doctors by name and was not sure if all of their care information was relayed to the new nurses. There are several solutions to improving communication and handoffs. Some of these solutions are the physical environment, confidentiality of patient, language, organization, and methods of communication. The location at handoff, the medical care team's ability to provide patients confidentiality, the choice of language and organization skills, and various communication skills and tools can impact how we effectively provide the best care to our patients. The first solution is to perform handoff communication at a quiet place without distractions such as a noisy environment. Distracted physical environment where the communication between staff is being performed can cause lack of attention to important patient information and interruptions from others. An ideal location for handoff would be at patient's bedside. Second solution is to always provide confidentiality of the patient. Care providers must always ensure patient confidentiality and transfer pertinent confidential information for optimal health outcome. The third solution is to use correct terminology, abbreviations, and appropriate communication skills. Staff should use standard medical terminology and avoid slangs or informal words. Accurate medical abbreviations should be used as it can cause confusions and medical errors, such as during medical administrations. Fourth solution is to stay organized. Being organized during the patient care period helps to stay organized during handoff. For example, developing an organized handoff sheet with organized notes on pertinent patient information during the shift can provide a clear and thorough handoff. Lastly, having a skillful communication skill is an important skill to improve communication at handoff. It is important for individuals to develop and use communication skills that are clear to understanding to prevent medical errors or adverse events. Some tools to improve communication skill is such as SBAR, Team Steps, and I Pass the Baton. In addition to these communication tool guides, reading back and confirming unclear information is helpful in providing the best care to the patient. At the clinical site of my choice, the existing handoff communication form was revised in much detail with additional information, patient data that should be included at handoff with an improved organizational arrangement on the sheet. This revised form was used by the unit staff for a month period, and many staff have indicated that communication at handoff was much more organized than before. Many more staff were seen using the revised handoff communication form throughout the shift, making notes. More than 90% of the staff were pleased with the revised handoff sheet, with few people desiring to prefer their own methods. Handoff communication at bedside has been effective as before, and patients seem to remember their care personnel when handoff communication is performed at the bedside with appropriate readings. In addition, team steps was being performed at the beginning of every shift with all members of the medical team and has been determined to be effective in being aware of the situation in the unit. Because the outcome of the change quality implementation was effective, interventions such as the revised handoff communication sheet will continue to be used on the unit. Many staff have found the revised form to be effective in handing off important patient information and medical data during the change of shift. In terms of performing bedside handoff, the unit will continue to encourage staff to perform handoff in the patient's room at bedside. During staff evaluations, nursing leaders have mentioned the importance of developing effective communication skills to nurses individually and will continue to stress patient confidentiality during staff meetings. If the goals are not being met continuously in the future, the staff should gather during staff meetings to determine what additional interventions may be taken to continue to improve handoff communication. And this is my reference page.